This is Klinefelter syndrome, and this has been Lehman. Here's where my video links will go. Klinefelter syndrome is when people have XXY chromosomes, a 3 instead of the normal 2. The affected body parts are testicles, breasts, and the general bone structure. With symptoms, sex will always be male. Because the Y chromosome is present, the SRY gene is there, and that develops the testes instead of ovaries, making them biologically male, or sometimes they can be categorized as intersex. The imbalance of testosterone causes, because of the extra X chromosome, the testosterone isn't regulated correctly because the testicles develop improperly. This can cause infertility, and the imbalance of testosterone messes with puberty later in life, and it can cause the breasts to develop because testosterone counteracts the signals of growth from estrogen to the breast tissue because it makes the breast tissue less sensitive to estrogen. And because there's less testosterone, it's more sensitive to the growth signals, causing the men's chests to grow. Like I said, the effects of male puberty are reduced because of the underdevelopment of the testicles, and this affects the bone structure because the testosterone normally causes signals for bones to densen and for the structure of the body to have more muscle mass and broader shoulders, but estrogen in women causes wider hips, narrower shoulders, and can influence fat distribution. This is more evident in people with Klinefelter syndrome because they have less testosterone. Mutations. Klinefelter syndrome is caused by an error during meiosis. So, this can mean that the extra X can come from an egg with 2 X chromosomes, or a sperm that has both X and Y chromosomes. Because it's a mutation, it's not genetic and isn't passed down or in family history. It's just basically random. There's about a 1 in 1,000 chance of any newborn getting it. The treatment, testosterone replacement therapy, and fertility support is for the underdevelopment of the testes. The testosterone is supplemented with injections, and this is to help the imbalance of hormones. Most people with Klinefelter syndrome can have speech impediments, developmental delays, physical impairments, or they can have mental struggles, or a mix of all 3. So the speech therapy is to help them overcome their speech impediments. Physical and occupational therapy is for fine motor skills, and mental health support is for anxiety or depression from their situation. Diagnostic tests. The most surefire way to diagnose it is a karyotype test, where you can see a picture of all their chromosome pairs, and if you see, it's pretty easy to tell if a person has too many sex chromosomes in their karyotype, because they'll have 3 when you're only supposed to have 2. hormonal level tests and semen analysis for adults that have gone through puberty. It's not a surefire test, but it's a good indicator if they show other symptoms that I talked about. The prenatal testing can be done to see if your baby might have it before they're even born, but it is an invasive procedure, so it might not be what most people would want to do. That's my presentation. I hope you enjoyed.